Alrighty, good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center here in the beautiful city of Mansfield, Texas. Just for perspective, it's not too far from Dallas, about 30 minutes, depending on what part of Dallas we're talking about. And at Livingspring Family Medical Center, we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you are watching live with me, please hashtag live. If you're watching replay, hashtag replay. I'm excited to have this conversation today. We're talking all things women. I'm topic today's talk, my vagina is dry, help me. And we're going to be having a guest today, Dr. Sarah Boyles. I'm waiting to hear back. She should be joining us shortly. But while we're waiting, I will give you a brief intro as to why we did this topic and more information about our guest. So, why this topic? So, one of the things I've had in conversations with clients, family members, sometimes with friends, is that sometimes this can be an issue. With vaginal dryness, which can increase the risk of urinary tract infections, painful intercourse, and things of that sort. And so it was important to have this conversation because it's not one that people generally like to volunteer, but it can affect quality of life, it can affect intimacy, it can affect closeness in relationships. And so it was a worthy topic to take on. All right, so who is our guest? Our guest is Dr. Sarah Boyles. I believe I'm saying that right, Dr. Sarah Boyles, and she is a board certified urogynecologist. So she specializes in gyne and urologist. So the the reproductive system of a woman and also the neurologic system of a woman. So we're talking, urinary issues. So it's a good combination of the guests in who we're going to have speak with us today. And she has more than 15 years of clinical experience treating women with pelvic floor issues. She has published extensively in her field and has been active in creating quality standards nationally through the American Urogynecologic Society. She has a YouTube channel, she has a podcast that focuses on helping women improve their bladder function while they're waiting to be seen by a specialist. And so she's someone definitely that is good to follow. Let me see if I can find out what the holdup is. Let's see. One second. Last time we spoke, she was good to go. So let me see. Let me see. I hope she's okay. All right. Hang in there. Those of you who are watching live, thank you for joining. Hang in there. I know what it is about this week. This week we've had guests show up really late. Partly my fault. So let's see. Give me 1 second. Let me check to make sure. Let me see. Okay, she's calling. Okay. Hello. Unmute. All right, our guest is here. Hi, how are you?
I'm well, thanks. How are you?
I'm good. I don't know what happened. I'm not sure what's going on with the links for StreamYard, but you're here. I was bragging about you. Talking about who you
Oh, I
are,
love
what
that.
you do, and how awesome you are, and how excited I am about this topic. But for the sake of time, can you, Doc, introduce yourself? Who are you, and what do you do?
Yeah, so my name is Sarah Boyles, and I am a urogynecologist. And urogynecology is kind of an unknown field for a lot of, physicians and women out there. And so that means that I did my training in obstetrics and gynecology, and then I did extra training, a fellowship in what is called female pelvic medicine and reconstructive surgery. And it's basically all things functional that can go wrong with the pelvis, all the things that you never thought about and didn't really want to think about. So it's a lot of conservative management, it's some surgery. I deal a lot with bladder leaking, sometimes stool leaking, prolapse, vaginal dryness, hormone issues, sometimes pain issues. I see patients clinically, and then I also do some work online educating women about these issues because they're things we don't like to talk about.
Yes, and that's why we're having this conversation.
It
Uh,
is.
all right, Doc, why do you do what you do? I'm curious, and our viewers are also curious too.
So that is probably the most common question that I get asked. Women ask me that all the time. My patients ask me that. Why would you do this crazy field? And I would tell you that I love it. I love taking care of women. I love talking to them about things that they don't really want to talk about and helping them kind of live their best lives. So, I get to do things like recently I saw a patient who had stopped playing with her kids. She had this weekly
Mhm.
softball game that she loved. She'd done it her entire life, but she was leaking. She leaked a lot when she was exercising, when she was running, and, when she was laughing with her friends. So she had started giving up activities. And, we ended up doing a surgery and that reversed all of this. And, she came back and she said, thank you so much. You gave me my life back. And it's a very quality of life focused field, but I get to help women get back to the things that they like to do, and that just gives me a lot of joy in my day-to-day life. So it's a great field.
Awesome, awesome. Now, for you as a specialist, I'm sure when the patient is coming to you, they already know they're going to have this conversation. But are there any tips, maybe for patients to kind of hint their primary care providers? I generally would say, where do you see yourself in a couple of years, or what are things you would love to do if I could wave a magic wand? And then I ask, why can't you do them? And that sometimes helps tease. And sometimes I ask directly any issues, down there. But are there tips for patients on how to better suggest this to the primary care doctor? But maybe
Topic. So, that is a huge issue, because a lot of times women bring this up. Physicians sometimes aren't comfortable talking about it, and patients aren't comfortable talking about it. And so I think it takes a little bit of prep, and I would say you have to talk about it. Don't worry about not using the right words. So there's a huge vocabulary around this. We don't like to
Mhm.
talk about the vagina. We don't necessarily know the words that describe the anatomy or the symptoms, and it's just important to get it out there and to say it. And I think a lot of times if you're having trouble, or you're not, maybe you have a new physician and you're just not as comfortable, it's okay to send a note before your exam and say, hey, these are the things that I'm interested in discussing, and then make sure that you bring it up at the beginning, because I think a lot of times we're a little bit nervous about talking about these things, and so you bring it up at the end of the exam, and then it's really too late to have a big
Mhm.
conversation about some of these nuances and the intimacy of some of these issues.
Awesome, awesome. So be an advocate, and you can send things ahead or have a list on your phone of things you want to discuss.
Yeah, and I think, there's a lot of shame with these issues, right? And I would say, this is a system failure. This is part of your body that's just not working the way that you want it to. When women have prolapse, it's a hernia, right? And we talk about abdominal wall hernias, but we don't want to talk about vaginal hernias. And
Hmm.
if you're leaking
Hmm.
urine, that means part of your urinary tract is not working particularly well. And there are other parts of the body that don't work well that we're happy to talk about, right? You're happy to talk about acid reflux or,
Right.
even constipation we talk about a
Right.
lot more now, but we don't like to talk about leaking. And it's just a system failure or, your system needs to be optimized, I would say.
Yes, quality of life. This is key. All right. So, Doc, next question. What causes vaginal dryness? And we can talk about younger women and older women.
Yeah. So, I think when we talk about eye dryness, I think people know what we're talking about. When you talk
Yeah.
about vaginal dryness, there are a lot of symptoms that are incorporated in vaginal dryness. Sometimes it's just an increased awareness of the vagina, right? Where you're kind of thinking about the vagina. It feels irritated. You can get burning. You can feel like you have a urinary tract infection. So there are a lot of different subtle symptoms that can happen, right? It's not always, oh, things feel very, very dry and less lubricated. I mean, that is what is happening, but you may feel the symptoms in a different way. So it's kind of a big spectrum of symptoms. The most common reason is a lack of estrogen. And I think we all know that, your estrogen goes down when you're postmenopausal, but in that perimenopausal, so frequently it's about 10 years before you're actually menopausal, your estrogen levels can decline and you can feel a lot of vaginal irritation. It's not just night sweats and hot flushes, right? You can feel these vaginal symptoms, and there's a whole syndrome that's based on this. So that means women who are in their late 30s, early 40s, late 40s can start feeling these symptoms, and they may feel these symptoms and not have hot flushes, right? They could just have the vaginal component, maybe feeling like you're having urinary tract infections with negative cultures. Even getting more urinary tract infections can be a symptom. But the other time that women can get this is anytime you're doing something that decreases your estrogen and maybe increases your progesterone, right? And that can be breastfeeding does this. Different forms of contraception can do this. The birth control pill can do this. Certain IUDs can do this, can also lead to these feelings. And that's something that a lot of younger women aren't really thinking about. But that can cause a lot of these symptoms too.
Awesome. Awesome. Now, I know we talked about multiple different causes, but can it be prevented? Is there something we can do to make sure our estrogen levels stay optimized?
Uh, well, I mean, the short answer is no. Unfortunately, right? I mean, we all have a certain number of eggs. You're born with a certain number of eggs. Those are all the eggs you get. The eggs make the estrogen over time, and you lose those eggs, those follicles over time. And so you stop producing estrogen. And that usually happens around 50, right? 50, 51, give or take 5 years. So you will run out of estrogen at some point in time. There are other cells that make estrogen, right? So our fat cells make estrogen. So women who are heavier tend to have fewer problems here, but I wouldn't necessarily advocate that, right? Because there are other problems that come with that.
Right.
I think it's important to be aware of birth control, right? And that birth control can definitely impact this. I don't think breastfeeding women necessarily think about, having vaginal dryness and that may be contributing. So I think it's definitely not a good reason to stop breastfeeding, but it's an important thing to know, that this too shall pass.
Yes. Right.
Um, but no, we run out of estrogen, and then you can supplement if you want to supplement, but not all women have to.
Okay. So let's talk treatment. Are there things that are not prescription that you would recommend? Some people are like, well, can I try some things over the counter? Are there things I should watch out for? What should I be on the, what should I try? What should I not try? Any tips, Doc, before I come to you?
Yeah. So I think a lot of women like to try things, right, when they're on their own. And if you are having a lot of vaginal dryness, there are definitely things that you can try and you can do. So I think, there are just some basic kind of care tips, right? You want to make sure that you're using just a very mild soap, right? Sometimes clipping hair instead of removing all of the hair can help, right? Because when you're removing all of the hair, you can do a lot of trauma to that delicate skin. And without estrogen, you might feel that a lot more. So, those are definitely things that you can do. You can use kind of a facial cleanser on that area because facial cleansers tend to be the most delicate. And that's something that you can do. And then there are a lot of moisturizers that people do. And, over the counter, sometimes women will use coconut oil, which can be very helpful on that area. Um, Sometimes, women will use petroleum jelly or Vaseline or even olive oil. So, the nice thing about coconut oil is that coconut oil comes in, more of a solid form than a liquid form. So it's a little bit less messy than some of the other things. But you can definitely use those moisturizers and, those can be a big help. And then there are different lubricants that you can use as well, right? So if you're having a lot of vaginal dryness, you should definitely use a lubricant. And there are oil-based, silicone-based, or water-based lubricants that you can try. And then there are vaginal moisturizers too. And a lot of times we'll recommend one with hyaluronic acid. And those are things that you can get over the counter too. Some of them are awfully spendy though. One has not been proven to be better than the other. And so I would say, get the one that's on sale. Don't necessarily get the one with the best marketing that's calling you. Because that tends to be the most expensive one. And then, when you're looking at vaginal products, you want to buy the product that has the fewest ingredients, right? A lot of times there are a lot of additives. Sometimes there can be a little bit of alcohol that's additive or scents, and those things can be more irritating, right? So you want to be really careful when you're trying new things because sometimes some of the products can be irritating and can make it worse.
Okay. I love these. These lots of self-help tips. Now, of course, I just want to say that these are medical suggestions. It's important to have an appointment with your own doctor to come up with a customized plan that's best for you. But these tips are good. And you mentioned here that more expensive is not necessarily better. So look at what's cost effective for you. Look and see the ones with less chemicals in it, or less things in it, so there's less chance for irritation. All right, doc. Now, if someone has tried all of this, I've done everything, doc. I'm ready to see my doctor. I've sent the list ahead of time as far as what I want to try, but I'm a little afraid because I hear that hormones can cause cancer and are bad for me. I know this is a heavy topic, pretty controversial, but what would you say for that person who's like, you know what, I don't want to try anything that has the word hormone in it, or what would you say to that? Like, how would you approach that subject?
Yeah. So there's a lot of fear around hormones, right? And I have this conversation every day with women. And so usually what I say is, we talk about the data and we talk about the evidence. And I say, let's have you try it and let's have you try it for a month. And if you notice a big benefit, then let's keep you on it. And if you do not notice a benefit, then we're going to take you off of it, right? Because when you're doing something preventative, or you're doing something to treat something, if you're going to try vaginal estrogen or an estrogen product and it's going to make you worry about cancer every day, well, then that's really not worth it.
Mm-hmm.
But sometimes when we have you try it and you're so much better on it, that little fear that you have goes away. And I think the important thing to know about estrogen is that how you take estrogen really impacts the risk. So there is a slight risk of breast cancer progressing more quickly when we give you oral estrogen, right? So if we give you estrogen by mouth or if we give you a patch, those doses are higher. And so the risk is higher. But if we give you vaginal estrogen and we give you a small dose, then that estrogen really stays in the vagina and the bladder, right? A little bit of it will get into the bladder tissues too, which is helpful. But if we checked blood levels, your blood levels would stay. If you're menopausal, they would stay in the menopausal level. So your estrogen level does not go up. And so that risk is very, very low. So when we give women vaginal estrogen, that risk actually does not increase at all. But such an important conversation because you can talk about these details a lot, but fear isn't necessarily objective, right? And so sometimes it takes a little bit of hand holding and trying and reading, and just educating before someone is comfortable with that. Especially, breast cancer is so common. Most women know someone, have a family member or a close friend, and that drives a lot of our feelings, right? Because you've seen someone go through something very difficult. But usually with a small trial period and a little bit of reassurance and education, that person will try it. Although I definitely have women who are not comfortable with it, right? And will pick to be uncomfortable rather than try the estrogen. The thing about vaginal estrogen, though, is that for this particular issue, it works so well and makes so many women so much more comfortable and gets rid of so many things you didn't really realize were happening
mm,
over time,
mm, mm.
um, that usually women want to continue
Yes,
it.
yes, yes. And I've seen that to be tried and true. Like, oh, wow, doc, thank you so much. It works, it helps. And so these conversations are important. Now, I have a very good question here. Someone's asking, well, you mentioned reconstructive surgery. How do you know when it's time for reconstructive surgery? When would you typically advise it?
Yeah. So my patients tell me when it's time, right? So I
Mm.
can't make it better if it doesn't bother you enough. So
Ah,
there has to be a certain degree of bother for you to choose to have a surgery. And that degree of bother is different patient by patient, right? So let's say I see 3 women with a stage 2 prolapse. So we grade them from 0 to 4. 4 is the worst. 2 is usually when it starts bothering people.
mm,
They have the exact same exam, but they'll have different symptoms and they'll feel differently about it. And they'll choose very, very different options. There are a couple of times where I'll push people to surgery. It's pretty rare though. If you have a big enough prolapse, you can have trouble emptying your bladder, and then that can impact your kidneys. So if I'm worried about renal function and your kidney function, then that's a time where I'll say, we have to do something here, right? This really isn't good for you. Sometimes you can get recurrent urinary tract infections, right? And so if you're getting a lot of urinary tract infections, then that's a time where I intervene. But other than that, it's really quality of life and you get to pick. And that makes it just such a hard choice, right? Because you have to say, yeah, this bothers me enough that I would pick to have a surgery.
mm, mm,
And that's a
mm.
hard thing. That can be a hard thing to do. So usually what happens is, we talk about it, women wait a little bit and then, they go on. And then by the time they go on to have surgery, they say, gosh, I wish I'd done that. I wish I'd done this earlier, but I think that's part of the process. And that means you were really ready.
Awesome, awesome. I like it. When it bothers you enough, then it's time to consider at least
Yeah.
having that discussion. Now, I have another
Well,
question.
and
Go ahead.
sometimes women come in and we talk about surgery, right? And they say,
Mm,
well, the symptoms that I'm having actually sound better than the surgery, right? I mean, sometimes you just need the education. And then
yeah,
when you find out what surgery entails, you think, well, that's not for me right now. You
right.
also have to have time and capacity for surgery, right? And
Mm,
there are a
mm,
lot of lifestyle reasons why it might not be a good time for you, right? So, kids, life, taking care of parents. I mean, there's just all kinds of things. Work, just feeling too busy.
right,
So,
right, right. Okay, so a lot of things to consider before you make that decision. I like that
yeah.
you brought in that perspective too. Now, I have a question. So, one of the things now that we're seeing, of course, we know that Pap smear is now recommended every 3 years, all things being equal. But what that people have translated that to is, well, I don't need to see my gynecologist, but for every 3 years. And I'm finding more and more that the more people assume this decision or this every 3 year thing, the less opportunities to present and deal with these issues.
Yeah.
What are your thoughts on this, and how would you advise for
Yeah, I think we're kind of missing the mark here, right? Because you're right. The recommendations are that you come in much less frequently. And so a lot of women do that, which is, fine. But then there's less chance for education. And I think, the thing that I think is unfortunate about all of that is that it has kind of eroded that patient physician relationship. So then lots of women don't have a trusted gynecologist to talk to. And the system is so bogged down right now, right? That, if you decide, well, I really do need to go see someone about this, it can be really difficult to get an appointment, right? And there are wait times. And then, I think anytime you meet a physician, it's like any other relationship. That person may be a good fit for you, may not be a good fit for you. If they're not a good fit and you want to find someone else, then that takes 6 more months. And so I think that's, unfortunate, because it is much nicer to have these conversations with someone that you know and trust. And that just doesn't exist as much as it used to. And so that's where I think conversations like this become super important, right? So we can educate women at home and say, if you're having these issues, yeah, you have to go see someone. These are, real quality of life issues that impact you, and you should absolutely seek help for it. So, but I agree with you. I think that that's a big problem. I mean, not that I want a pap smear every year, but I think the conversation's important and the relationship is important.
Yeah, and I'm actually recommending patients have a gyne exam every year with a pap every 3. Like
Yeah.
that's safest. And that being said, I have to say I'm a big fan. We didn't talk about this earlier, as far as you being on. You have a podcast, you have a YouTube channel. You're all over the world wide web. So I'm going to ask Doc, the people who are watching live, who are watching a replay, who's like, I like this Doc part. I like how she explains things. I like how she breaks it down, and she seems very relatable. Doc, where can people find you?
Yeah. So I have a website with a blog and lots of information and some new courses that are coming up on bladder leaking. And that's at www.thewomensbladderdoctor.com. And then in February, so it's still pretty new, I started a podcast that's called While You Wait. And it's to help educate women before they come in to see a pelvic floor specialist. And that could be because they're waiting for an appointment, or maybe they're not ready to. So, one of the things that we know is that women wait about 7 years before they talk to a provider about these issues. And so, a lot of women are looking for information. And so I just wanted to provide, some evidence-based information that's out there to help you get started. And, I think one of the problems is that, there are lots of issues, but there's a lot of marketing focused on perimenopause and menopause and women's health issues right now. And it's just really hard to figure out what's marketing and what's good data, because it kind of looks the same online.
Mm, mm, mm. I'm taking time I want to share your information so people can watch this on the screen.
You're an amazing multitasker. I don't know how you do that. I can't type and talk and look professional at the same time. I start making very funny faces.
I have help. I'm not gonna lie. But I want to put all that information. Ladies, you hear it. There's her blog, her Instagram, her Facebook, her Pinterest too. That's fancy, Doc. I have to say. And your YouTube channel as well, and your podcast. So I'm sharing all of that, and it's in the comment section as well. But thank you so much, Doc, for doing this. I appreciate you. I know you're busy, so I thank you for taking the time to do this with our viewers.
Yeah, I think education is key. And, I would say if you're having any pelvic issues, bring it up, talk about it, right? Because you're not the only one.
True. Thank you. And thank you to all those who are watching live. I appreciate you. Remember, caring is sharing. Simply comment in the chat, forward this to those who could find this useful. And as always, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area, I am she. Have a good one. Thank you so much, Doc. We'll do this again in a couple months.
I would love to. Yeah, this was great. Thank you so much.
Thank you.
Have a
Bye.
good one.
You too.